If you with a provider who just says, look, we're just going to put the implant in and you got, that's going to be it, they don't want to see you again, you really should reconsider. And there's 5 things I'm going to mention about this device that you really should consider before you actually have one placed. Or if you've got one placed now, this may actually provide you a little bit of education on what to expect with it. Dr. John Lucio. I practice integrative medicine and pain management in Jefferson City, Missouri, and welcome to our YouTube channel, J&J House Call. Today I'm going to talk to you briefly about a device that we placed in the back for pain control. It's called a spinal cord stimulator, and it's been used frequently throughout the country. I've been using it since 1997 or 1998, and probably the first one here in our region to introduce it to for patient care. There are some things you do need to know about this device. It does use electricity, a very small amount, and it's placed into an area called the epidural space in the back. And there's 5 things I'm going to mention about this device that you really should consider before you actually have one placed. Or if you've got one placed now, this may actually provide you a little bit of education on what to expect with it. Number 1, before the device is implanted, you do have to undergo a trial. Now, the trial is very important. It's probably the most important part of this whole process, in my opinion, because it really determines your level of success after you had an implant. You do have to achieve at least 50 to 70% improvement. Medicare requires 50% improvement before you could go to implant. I usually require 70% improvement. The reason for this is if you start at a very low threshold, in my experience, the device tends to not work as well after a year or even longer than that, and you end up having to put the patient back on medications, or you're starting the whole process of doing injections again. So I really like to start at a very high level of pain relief during the trial. The reason for this too is it's a very subjective trial. It's not a scientific or objective trial. It bases a lot on your pain relief, which is different in many different people. Some people can tolerate more pain than others, and I've had some patients who wanted the device to work so well that they gave me a great score, a pain relief score after the trial, and after we implanted it didn't work quite as well. And I understand that some people are very desperate, but please be honest with yourself and with the physician whenever you're doing the trial. If it works, great. If it doesn't, just tell them. Number 2, after the implant is placed, so you've already done a great trial, now you've gone to the implant portion of the spinal cord stimulator, other things have to be done. So if you expect that the spinal cord stimulator is going to take care of all your pain forever, and this is the end of the treatment, I think you're going to be disappointed. You really should start looking at functional improvement. I typically start my patients in some type of physical therapy after the implant. Make sure they get strong, make sure that they can do their range of motion, make sure they can get back to work if that's their goal. Number 3, after the spinal cord stimulator is placed, it is not going to take care of all of your hip, knee, or ankle pain. I've had patients that have had multiple issues. They've come in, they've had the stimulator placed by someone else, and they were surprised to find out that it didn't take care of their hip pain, didn't take care of their knee pain. And lo and behold, when you do x-rays or MRIs, you find that they have a significant arthritis there. The stimulator was simply cannot be expected to handle those things. It is really made for people with low back pain and have nerve type of compression that's causing pain going down their legs. Number 4, after the spinal cord stimulator is placed, do not expect it to take care of conditions in the future. So let's say you had the spinal cord stimulator placed 10 years ago, your back starts to worsen. The spinal cord stimulator cannot handle every single issue that comes up. If you have a new disc herniation, it can actually, you have breakthrough pain that the spinal cord stimulator cannot handle. You will experience significant discomfort. So it is not made for those types of issues. Ideally, when I have a patient come in, this is Dr. Sue.
Hi guys.
Yeah. When I have a patient come in, I advise them that when we're going to place a spinal cord stimulator, that we've given them a window opportunity that they now have to use. They have to get back into exercise. I do start concentrating on their diet. I do start to prescribe an anti-inflammatory diet, and I do start focusing on their sleep because many of my patients have so much pain they cannot sleep well. Number five, recently one of the companies that makes these devices has been approved by the FDA to cover diabetic peripheral neuropathy. Now, this is fantastic. Diabetic peripheral neuropathy is a very hard problem to treat. It is very painful and debilitating for many patients. And now we have approval, which means now insurance should cover it. So I hope that provided you some information on the spinal cord stimulators. Again, we do not place these in willy-nilly. We make sure that the patients are good candidates for this. And if you're considering this having done, make sure you ask your physician a lot of questions about what to expect after the implant, what the plan should be. If you with a provider who just says, look, we're just going to put the implant in and you got, that's going to be it, they don't want to see you again, you really should reconsider. I hope that helps everyone. Thank you all for watching.